Employment's a tricky one in terms of certainly within private sector. Public sector, as always, have a quota, so they have to have a certain percentage of people that have various sort of varying disabilities. Although I don't really see mental health as a disability, I just see it as something that happens. And historically, I never ever told an employer that I had mental health, again because of the stigma around it, and also I hadn't disclosed it when I went for the job interview. And also I always had this theory that you've got two candidates, both got the same qualifications, same experience, but actually one disclosed they've got mental health and the other one doesn't. I think from a purely financial point of view, an organisation will think, well, hang on a minute, this person might be off for a long period of time. Again, they're going by the interpretations they receive from the media or from other family members, or maybe their own experience that they've had a family member that has spent a lot of time unwell, unable to go to work, that they are always going to have that balance. I think it depends on industries you're in. I think in entertainment, media and stuff, it's more accepted. In accountancy or construction, it's certainly something that, you know, I still... unless that organisation has been educated, I wouldn't necessarily advocate it. I think you have to gauge it at the time. I'm trying to encourage the government to offer tax incentivisation for companies. So if they take somebody on who is fit for purpose, they are fit for that role, that actually, and they then become unwell, there are companies, that the more sensible ones, that already have insurances for this thing. So they will have insurance that if that person's off, it doesn't cost the company anything. Obviously that insurance policy pays out. So therefore the company's not so worried about them being off for 6 months on a financial level, but in terms of an organisational structure, there is a fear that if somebody's at top tier management and they are off for whatever reason for a sustained period of time, you know, what does that do for the infrastructure of that company? My argument is we need to work towards actually engaging our employees, because actually if you have a healthy workforce, you have a healthy production in your business, is actually we will look at phasing in, phasing out policies. So say I was a senior management in an organisation and I'm suffering from anxiety, what I would be looking for is to be able to have that open conversation and phone my chief exec and say, I'm really struggling at the moment, I don't think I can come into work. I would then hope that the chief exec may sort of invite the conversation of, okay, could you come in and we look at what we can do to help you be in work, maybe deploy you to a lower position for that period of time where you're unwell, and then you can go back into your normal sort of remit once you become well enough again. That saves the need for new training. There could be somebody that sat right underneath that person that, yes, would welcome the opportunity to be able to support their sort of superior, but actually you're working together. They don't have to present it that they've got a gastro infection, and actually they can have that honesty and say, actually I'm anxious, and how can we work on this, and how can we make it be of benefit to both the end person, i.e. the person struggling, but also the employer. So I wouldn't say no, don't disclose. I'd say do your research before you make that judgment.